Oh, actually, it will be the third case. I will correct. I corrected the toric appearance on raw face with lots of thread, which is composed of Cog Pro 3 and Cog Master gear. I will also add Cogging screw plus. So I will apply more than 30 threads on one piece, so it takes time. That's why I already inject the lidocaine and tumescent solution to the patient face. And then, let's start. So if you have questions, anytime's okay. Okay, so I will show you how to make a design. So I should draw a line from the lateral canthus vertically, and then like this. Do you observe this? Okay. Lateral canthus to vertically, and then make another line from the base of ear to mouth corner. The same. And then I divide the line. I just make a point here where the thread should go. I will follow this direction and this direction like that way. And then I make another line through marionette depression. Okay? Also, you can divide the line to 4. Okay? And you'd better draw the line through nasojugular groove. Okay? As I said, I already inject lidocaine solution on inserting point here. So side bone, anterior point of tragus, and base of ear. The same in this side. And then I also add some more thread from here to this area to augment the medial mala. So I will inject the lidocaine here too. And I infiltrated the tumescent solution through the pathway of the thread. Here, here, and here, here. So I already completed it. Then I will apply the thread. Okay. So for superior vector, I will insert the thread from the hairline, near the hairline. Okay. Okay. So you can choose the thread. I usually apply Cog Master gear because I'm used to use it. And if you have some concern with the thick thread, you can also apply Cog Pro 3 or 2 because it has loaded on cannula. It's easier not to make bleeding or hematoma. So first of all, pulling up. Cog Master gear. And insert the thread till the line. But do not cross the line. If you cross the line, you can, the tip of thread will stick out. And then twist 1 or 2 rounds, remove the thread. Okay. You'd better put a piece of gauze on hair. You should keep pulling the tissue, and then I will insert second one. this way. But be aware of depression under zygomatic edge because there's a retaining ligament there. So in that point, you do better pull up the tissue superiorly, okay? So then you cannot make depression around there. I will apply third one. If I remove the needle, then the thread will be loaded on tissue. So before removing, you should keep pulling. And then the last one. If hairs are inserting through the hole into the skin, it can make some infection. So be aware of it, okay? So, but if you have infection, but I don't care so much, give them antibiotics. It will be controlled in weeks, 1 week or a little bit more. And then, not yet. So I will do the same procedure on the other side. First, making a hole with 18 gauge needle. I will apply. Do we have enough? Yes, we have 6. Okay. Yeah. All right, press more. Okay. Pulling the tissue and across the line. You can twist the needle to make it easy to run through the tight tissue this way, and put the depressed area here. Remove. Okay, I'd rather add one more step. Okay. So you can compare both sides and control minimally. Do not pull tightly, hardly, because it can make distortion and irregularity. I do not recommend. Just on natural position, when the patient sit up, the tissue will go down. But in this position, the tissue will go back to neutral position. But in my clinic, I usually put a pillow under the shoulder to make chin is superior to forehead. Okay? So then I can cut the residual tips. Do not pull hard. Chin up. Just sometimes you can burst the superficial temporal vessels, but it causes massive bleeding. Not so massive, some bleeding, but don't worry, just compress it. It's okay. You don't have to worry about that. Yes, sometimes I made a big hematoma around here because I forgot to press it, but it will disappear in weeks. I have another tip. It's very rare, but if you make a big hematoma which has a large volume, you can resolve it with a higher lace. If you inject the higher lace, it will disappear immediately. Okay? And also there are some patients who got allergy to a higher lace. You should be very careful. Okay? So I correct superiorly, and then I will insert the thread from the tragus to vertical line. This way. 있습니다. It's a little bit higher than tragus, but I will insert the thread here. Goes. Pull the tissue laterally because we should insert this thread to correct the nasolabial port. Not correct, to improve the nasolabial port. This is Pro 3. Mm-hmm. Do not cross the line. Mm-hmm. You should keep pulling the tissue laterally. Okay. So, in neutral position. So, next time we'd better to take a picture before the operation. Then we can compare it after the procedure. Bring the tissue. So I've already insert 16 thread on pace. You can compare. My loving. It's enough. So yes, the secret is the number of thread. If you add more, you can you will make a difference. So you'd better make a package so you don't have to count the exact number of thread. Okay? Actually, okay, I will introduce the program in my clinic. I divide the program, phase. The level 1 and level 0 is I just insert mono thread, 20 mono thread along the mandibular margin. It's just for a young lady who's around the 20s. So it just augmented the shape of low face, but it doesn't work so much. And then the second one, the what we call mini V-line lifting, I insert 4 thread on one face. Do you remember the procedure I did before the lunch? Okay, 4 here. So it's very simple. I usually do the procedure more than 10 procedures a day because the minors are very trained well to prepare the procedure. Yes, and then the third one, it's not mini V-line, V-line lift. So I insert almost around 30 thread, including this, and the level 4, I mean the level 0, 1, 2, 3, level 3, what I call the 3D lifting. With this insertion, I also add long thread from the temple to side bone and going back. I also do the same procedure from the side, mastoid to low face or under the chin, going back again. So I also add some more cogging screw plus or cogging screw on the medial face. Okay, so I think that it's clever for you to make this kind of program. Then you can add, if you want, you can use less thread if you don't want. Okay, so do not follow the number. Number is not important because the condition of skin of each patient are very different. So then I recommend you to use thicker one and more thread. You should use more thread to make a big difference. So then if you make a big difference, you will get more patient. Okay? So I will insert the thread from the base of ear to the marionette line. Okay? Middle. Plane the tissue. I dissected a cadaver on it, which I applied thread on. The layer was not regular. Sometimes I go sometimes superficially, or sometimes I go deep, but it works. We do not follow the strict layer. Okay, we should compare. And the other side. Uh, 7 years ago, at that time, there's only mono thread is released even in Korea. So then I usually applied more than 200 thread on the face.
You can't see.
You can see. Okay, sorry. So after that procedure, I cannot have making a big bruising on face. So it takes long time, around more than a week, for patient to be recovered from bruising and hematoma or swelling. But this kind of cannula loaded thread make it better. Okay. So finally, I injected almost just mild rubbing. There's some dimpling around here, so little bit, not completely. Okay. Okay, and then. So you might feel some protrusion around here. So do not apply this method to patient who has prominent lateral zygomatic eminence. Okay? So there is some protrusion you can see. And then I will apply Cogging screw plus to augment medial mala. Okay. This way. So it's loaded on middle. So, and there's lots of arteries around here. So it can make bleeding. It bleeds here. Okay. And then if you have questions, please let me know. I know it's painful. I'm using Cogging through plus. Do you remember the thread? The spiral cog outside and bidirectional cog inside. I already loaded 8. Oh, but the level is a little bit different. But we're better to apply more to correct the better. It's okay. So then you do better to wait for a moment for less bleeding. Okay? And then I will tell you some more tips. I will not insert the thread more. Okay, so I can correct the wrinkle on lower eyelid. So with corkscrew or just a spiral one. So I cannot remember the exact name. There's a not called spider thread. No, it's okay. There's a not called spider one. So if you inject it through the eye line like this, or you can inject it a pen shape like this. But it has it is loaded on sharp needle. It can make many bruising. So nowadays in Korea we have what I call eye thread, which is the same with a spider thread loaded on blunt tip. So you can easily apply it through the eyelid skin. And then to correct the stereotrope and nasal jugal group, you can pull up the tissue and you can insert the thread from lateral to medial. But you should insert at least 3 or 4 threads. I recommend 4O or 2O, so you can improve the nasal jugal group. But it cannot erase it. So if you want to improve more, you'd better to add some filler together. Yes, it's my secret too. As you know, you can add fillers and Botox in some strict area, so you can make better result. And then you can also insert some cogging screw around the on lateral canthus to improve the claw fit or globular. And then let's remove the needle. Okay, it bleeds, so we should press it. Okay, press this. And then press it too. Okay, that's it. So as I recommended, you can make a level of a procedure, so you can title them. So it's easier to persuade patient to get the procedure. Okay, we can. So for this thread, you can pull mildly, like this. Okay, push. Press that. You can add more thread from the side one to the scarf, to the temple, this way. But you should be careful not to bursting the superficial temporal vessels. But once you break the vessel, it's okay. Just press it. It bleeds much, but don't worry. It will disappear soon. And then that's all. So you should want the patient, when they open the mouth widely, they feel terrible pain because it irritates the periosteum or some sensitive tissues. So reassurance is important. And then, as I said, there's some tick sound. It doesn't mean the thread broken. It's because of the slippery of the cord from the tissue. So it's okay. Don't worry about that and reassure the patient again. Okay, I ended the procedure. So can I see the result? So I cannot compare the result. Okay, so we cannot find out on here. And malar areas are well augmented. There's swelling, so because we infiltrated the tumescent solution much, so we'd better apply ice pack for a couple of hours.